A very important question is, should I wait and do cataract surgery rather than do RLE surgery right now? I think we've talked about this in a previous video, and the way I look at this is patients usually have an issue with their vision when they come through our doors, and sometimes they've never worn glasses, and suddenly at age 45 they're starting to use reading glasses, and that it's just inconvenient. They, maybe at age 50 they have 3 pairs of reading glasses, one for every task, and it's just really hard to find the right one for the right task, and misplacing glasses. So that's a pretty common complaint that we address with multifocal lenses, and then get patients out of all of those glasses. But then there are patients who have worn glasses all their lives. They've been nearsighted all their lives, and now at age 45 or so, they're just not super thrilled with these new bifocal or progressive glasses that they have. It's throwing them off. They just don't like the glasses. And so those are all good reasons for getting out of glasses for good with the advanced technology lenses. But there's always the option of waiting. I mean, glasses are great, and if you're not glasses and contacts, and if you're not bothered by them, and I would say the majority of people are not bothered by glasses or contacts. They do just fine. They're used to it. Then the RLE surgery certainly doesn't make sense to do, and then you'd simply just wait until the march of cataracts towards blindness, and cataracts are the number one form of blindness in the world, is it's inevitable that you'll get it. In America, the typical age for a visually significant cataract is about age 76 or so. So ultimately, insurance will cover your surgery, and you'll be able to get this done. But for those people who are just don't want to deal with glasses, even for 30 minutes a day, then the solutions is always going to be here. You can get these multifocal lenses that allow you to see near and far each of your eyes, provide that balance between the two eyes, correct for the astigmatism, the nearsightedness, the farsightedness, the range, presbyopia, and then these are, again, forever lenses. So, they shouldn't stop working all of a sudden after, 10 years, 20 years, 30 years. They should continue to work. And they'll outlast all of our lifetimes. They're very resilient. Plastic is very resilient. Other reasons to not do surgery. Well, there's plenty of reasons to not do surgery, or just the perception. You feel like it's too risky. If you have doubts about it, I would say waiting is always an option, and it's always a good option too at that. Yeah, but I try not to sell RLE, but I think just to harken back to why we do RLE, and it's just to provide that ounce of luxury to the patient and convenience, right? To be have freedom from glasses, to be able to see everything all at once, and to have that ability, and that constant for for the years to come, all your years to come. I think that's valuable to some folks. It's certainly, it's an investment, but for the right person who's bothered enough, it's a good investment. Thank you.